Welcome to this video on nursing ethics and law, focusing on the fundamentals of nursing practice. Which ethical principle is demonstrated when a nurse respects a patient's decision to refuse cancer treatment? Is it beneficence, non-maleficence, autonomy, or justice? The correct answer is autonomy. This principle refers to the patient's right to self-determination in healthcare decisions. Refusing treatment is a fundamental aspect of this right, which providers must respect. A nurse holding the hand of a dying patient to provide comfort is practicing which ethical principle? Veracity, beneficence, fidelity, or justice? The correct answer is beneficence. This is the duty to do good and act in the patient's best interest. Providing emotional support and comfort measures are active ways of practicing beneficence. Primum non nocere, which means first do no harm, relates to which principle? Non-maleficence, beneficence, accountability, or confidentiality? The principle is non-maleficence. This is the obligation to avoid causing harm, requiring nurses to protect patients, prevent medication errors, and maintain competence. It is the bedrock of medical ethics. Allocating scarce medical resources, such as ICU beds, fairly among patients is an example of which principle? Autonomy, justice, fidelity, or veracity? The correct answer is justice. Justice refers to fairness, ensuring equal treatment regardless of status. Distributive justice specifically deals with the fair allocation of scarce resources. A nurse who admits to a medication error immediately after it occurs demonstrates which principle? Veracity, fidelity, paternalism, or altruism? This action demonstrates veracity, the duty to tell the truth. Owning up to mistakes is vital for patient safety and maintains professional integrity. Deception violates trust in the nurse-patient relationship. If a nurse tells a patient, "I will be back in 10 minutes to check your pain," and returns exactly then, she is upholding justice, fidelity, confidentiality, or non-maleficence. The correct answer is fidelity, which is faithfulness and keeping promises. Following through on commitments builds crucial trust. Abandonment is considered a violation of fidelity. Discussing a patient's diagnosis with a colleague in a crowded hospital elevator violates which principle? Informed consent, confidentiality, beneficence, or veracity? This action violates confidentiality, which protects private patient information. Information should only be shared with the direct care team in private settings to prevent eavesdropping and privacy violations. What is the primary role of the nurse regarding informed consent for surgery? Is it explaining the procedure, witnessing the signature, convincing the patient, or listing all risks? The primary role is witnessing the signature. The surgeon explains the procedure and risks. The nurse's role is to ensure the signature is authentic and that the patient is competent and not coerced. Performing a procedure, such as an injection, on a patient against their will without consent constitutes assault, battery, negligence, or fraud. This constitutes battery, which is intentional, non-consensual physical contact. Assault, by contrast, is the threat of harm that causes fear. Forcing a treatment on a refusing patient is an example of battery. Which of the following is not a required element to prove negligence? Duty of care, intent to harm, breach of duty, or injury/harm? The element that is not required is intent to harm. Negligence is unintentional, defined as a failure to act reasonably. If there is intent to harm, it becomes an intentional tort, not negligence. Professional negligence is typically referred to as misdemeanor, malpractice, libel, or slander. The correct term is malpractice. This is negligence committed by a professional, such as a nurse, involving a failure to meet the expected standard of care for that profession. Preventing a competent patient from leaving the hospital against medical advice, AMA, is an example of invasion of privacy, false imprisonment, battery, or defamation. This is false imprisonment, which is detaining a person without legal authority. Competent patients have the absolute right to leave AMA, and restraints cannot be used solely to prevent their departure. Writing a false statement in a patient's chart that injures their reputation is known as slander, libel, perjury, or fraud. The answer is libel, which is written defamation. Slander is spoken defamation. Both are torts that injure a person's reputation. The Good Samaritan law generally protects health professionals when making mistakes in the hospital, giving emergency care outside, following wrong orders, or reporting colleagues. The Good Samaritan law protects professionals who provide emergency care outside the hospital. It shields them from liability for ordinary negligence, provided the care is voluntary and within their scope of practice. Which body regulates nursing standards and ethics in India? WHO, Indian Nursing Council, INC, TNAI, or AIIMS. The regulatory body is the Indian Nursing Council, or INC. The INC is the statutory body that sets the code of professional conduct and regulates nursing standards and ethics in the country. An ethical dilemma arises when a nurse dislikes a patient, a clear legal rule exists, two moral principles conflict, or the patient refuses payment. An ethical dilemma arises when two moral principles conflict, meaning there is no clear right answer. An example is when patient autonomy conflicts with the nurse's duty of beneficence. When a nurse overrides a competent patient's decision for the patient's own good, this is defined as advocacy, paternalism, altruism, or accountability. This is paternalism. It involves acting like a parent and overriding autonomy for the perceived good of the patient. This practice is generally discouraged in modern healthcare, as it violates autonomy. The legal document that allows a patient to state their end-of-life wishes while still competent is an incident report, advance directive, informed consent, or discharge summary. This document is an advance directive, also known as a living will. It extends patient autonomy, allowing them to dictate care choices, such as CPR or ventilators, even when they become incapacitated. Withdrawing life support measures, like a ventilator, from a terminally ill patient to allow them to die naturally is considered active euthanasia, passive euthanasia, involuntary euthanasia, or assisted suicide. This is passive euthanasia, which involves withdrawing life support to allow natural death and is legal in India. Active euthanasia, such as a lethal injection, is illegal. The end. Which ethical theory is best summarized by the principle, the greatest good for the greatest number? Is it deontology, utilitarianism, virtue ethics, or rights-based ethics? The correct answer is utilitarianism. This theory focuses on outcomes, where actions are judged by their consequences, aiming for the maximum benefit for the largest population, often seen in disaster management. Which of these concepts relates to the expected level of clinical ability and behavior for a nurse? Standard of care, professional boundaries, confidentiality, or informed consent? The correct answer is professional boundaries. These boundaries protect the therapeutic relationship and prevent exploitation of the patient's vulnerability. Nurses must maintain objectivity and strictly avoid financial or sexual misconduct. Which action involves formally reporting workplace wrongdoing to protect the public from harm? Is it advocacy, whistleblowing, delegation, or supervision?